Good morning, everyone, and thank you for joining us for this important and dissemination event. I'm Nia Johnson, a Senior Program Officer in the Board on Life Sciences and the Board on Animal Health Sciences, Conservation and Research, or BASCR, which was formerly ILAR and now exists in the form of BASCR, here at the National Academies of Sciences, Engineering, and Medicine. I would like to welcome you all to the Contingency Planning and Training of Personnel Rule APHIS-2020-0101, 1 year of implementation, proceedings in brief release webinar. The workshop is organized under the auspices of the National Academies Roundtable on Science and Welfare of Animals Involved in Research, and marked a significant step forward in understanding the first year of the rule's implementation and its impact on the research community. Today's dissemination event will discuss the insights captured in the proceedings in brief and supplemental materials stemming from the workshop. To provide a bit of context, this rule, which went into effect in January 2022, was a long-awaited response to lessons learned from disasters such as Hurricane Katrina. It emphasizes structured planning and preparedness to minimize the impact of emergencies on animals regulated under the Animal Welfare Act. The USDA's Animal Plant Health Inspection Services Contingency Rule represents a critical commitment to safeguarding animal welfare during emergencies, ensuring not only compliance, but also a proactive culture of preparedness across research institutions, exhibitors, dealers, and other regulated entities. Our workshop was designed with specific objectives in mind. We aim to examine successes, challenges, and lessons learned from the rule's implementation. Discussions centered around key themes such as comparative implementation across diverse institutional types and the efficacy of training programs and full-scale exercises. Notably, we also explored active learning techniques in preparedness training, the roles of institutional oversight bodies like IACUCs, and the critical need for further guidance and resources to support effective implementation. The proceedings in brief captures the breadth of these discussions, offering a multidisciplinary perspective from government, academia, and industry stakeholders. It highlights insights from presentations and surveys conducted to understand stakeholders' experiences. What emerged clearly is the importance of cross-sector collaboration to address the complexities of contingency planning and training. For instance, we heard from representatives who described the success of scenario-based approaches in improving preparedness outcomes. Similarly, discussions highlighted innovative strategies for engaging personnel at all levels of an organization to create a culture of readiness. The supplemental materials further enhance our understanding, providing illustrative examples from the Planning Committee's questionnaire. While these results are not statistically representative, they underscore key challenges, such as the development and retention of effective training programs, and highlight areas where tools and resources like model plans and online training options could be particularly beneficial. These materials also emphasize the value of practical exercises that simulate real-world emergencies, which help institutions evaluate and refine their contingency plans. Excuse me. In reflecting on these materials, a central theme becomes apparent. Contingency planning and preparedness require not just compliance, but active engagement and innovation. By addressing the unique needs of stakeholders and fostering collaboration across sectors, we can enhance the implementation of this rule and ultimately strengthen our collective ability to ensure the humane care of animals during emergencies. Additionally, the discussions revealed opportunities for creating a portfolio of resources, including templates, best practices, and interactive training modules that could further support institutions in achieving these goals. Thank you for your time and attention today. I encourage you to actively engage in the discussions ahead, as your perspectives and experiences are invaluable to advancing this important work. Together, we can build on the lessons learned and drive meaningful progress in contingency planning for the benefit of animal welfare and the research community. I look forward to today's presentations and discussions. And now I'll turn it over to Dawn. Dawn?
Thank you. Well, good morning, everyone. I'm Dr. Dawn Fitzhugh with Animal Care's National Policy Staff. My colleague, Dr. Louis DiVincenti, is currently serving as the Director for Animal Welfare Operations in Animal Care. And so I'm happy to be here with you today to discuss the proceedings. Thank you to the National Academies, to the members of the committee, and to all of you in the regulated community, as well as the general public, for being here and for the work that you put in, for participating, and for listening. Your investment of time reflects your commitment to the welfare of animals, and we really do appreciate that. So how did we get here? As Naya mentioned, this rule was a long time coming. What we know about the history of contingency planning is that since 2001, the animal welfare regulations have required facilities with marine mammals to have written contingency plans. But what about the rest of the regulated community? Well, the need to address the welfare of animals during all disasters came as a result of the devastating impact of Hurricane Katrina in 2005. And for those of us who've been around long enough to remember that hurricane season, of the whole season of 2005, showed us that we weren't ready. And when it came to helping animals in the wake of disasters or emergencies, we especially weren't ready. You can move to the next slide. So the timeline then is shown here. As you can see, Hurricane Katrina occurred in the summer of 2005. In October of 2008, APHIS first proposed the contingency plan rule. The rule became final in 2012, but it was then put on hold or stayed while APHIS reevaluated the potential impact of the rule. Mainly this was because of small businesses. So there were small businesses that, because this rule impacted all of the regulated communities, so the research facilities, exhibitors, breeders, carriers, handlers, everyone, the APHIS reevaluated it, and it led to certain de minimis exemptions to licensing, which we still have today. In 2020, Congress required APHIS to lift the stay on the contingency rule. A modified version of the original rule was proposed in June of 2021. Of note, that's pretty important, is APHIS removed the requirement for documentation of training. And we also created an optional form to increase the ease of use and to decrease the burden of time associated with contingency planning. Contingency plans were to be put into place by July of 2022. And in an effort to better understand the impact the rules had on businesses regulated under the Animal Welfare Act, APHIS started studies in September of 2023. So what you'll hear from today is a result of that effort for APHIS to better understand how the contingency rule has impacted the regulated community. We have other studies underway understanding how the rule impacted carriers and handlers and those transporting animals. So this leads us to today's timeline, which is January of 2025, where we will hear the results of the finding. But before we get to that, I just want to briefly review the contingency rule. Next slide. So that we're all starting from some general information. APHIS recognizes that individual circumstances for regulated entities may be different. So because of this, the regulations require that a plan be built on the framework of 4 criteria. The criteria are modified from FEMA's Ready Business campaign, and they're modified to address animal welfare concerns. The framework, as shown here, it can be simplified as when something happens, what will be done, by whom, and how. So those are those 4 bullets there on the slide. They can be simplified in that way. Within this framework, though, it's up to the regulated community to develop their plans to safeguard the welfare of animals while considering what emergencies or disasters their facility may experience. A written plan is required as documentation, and so is an annual review. So those 2 key components must be in writing. New employees must be trained within 30 days of their start date, and when substantive changes are made to the contingency plan, Employees must be trained on those within 30 days as well. Next slide. What were the goals of this study then? APHIS really wanted to learn more about the contingency planning rule and the impact that it's had on the regulated communities. So like I said, this is for the research facilities, but we also have efforts underway to understand the impact on other communities as well. We want to understand how we did with the rollout and implementation of the rule, and we want to know if the resources we provided were sufficient and effective, and if our estimates on things like time were reasonable in developing a plan. Most importantly, though, we want to know how and what APHIS may need to do to help the regulated community improve their readiness to care for animals during emergencies or disasters. And so with that, I'll turn this over to Dr. Susan Harper, who will talk to us more about the efforts that were made and the results of their findings. Thank you.
Thanks very much for that introduction. My name is Susan Harper, and I served as the chair for this committee. And I'd like to start off by recognizing the members who worked with me, and these include Leslie Colby, Carrie Fiala, Margaret Landy, Jason Volano, Temery Wilder, and Wanda Wilson-Egby. So you'll notice that our committee was relatively small considering the scope and timeline for this project. However, that did not deter our progress because of the dedication and collaborative spirit that each of these members contributed to this effort. On a personal level, this has been an amazing group of individuals to work with, and I feel very fortunate and proud to have been part of this team. Next slide, please. And I would also like to thank the distinguished panel of experts who participated in the workshop and are listed on this slide. I won't go through all of the names, but it's clear that we were very successful in bringing together an impressive group of well-known and highly esteemed authorities who were eager and willing to provide their unique outlooks and perspectives on contingency planning. As expected, those who attended provided overwhelmingly positive feedback, with many participants expressing their sincere appreciation to be able to hear directly and gain firsthand knowledge from these thought leaders. Our understanding of the complex nature of contingency planning has improved, and we are better prepared to take on these challenges and responsibilities because of their participation. So, on behalf of the committee and our audience, I'd like to sincerely thank each of these individuals for their willingness to generously share their time and expertise with the research community. Their contributions made this workshop a unique and memorable experience for all of us. Next slide. When our committee was initially convened in February 2024, about a year ago, we decided early on to design an anonymous survey that would allow us to collect data on the research community's experiences and challenges with the contingency rule. And that would guide our planning efforts to make sure the content of the workshop reflected stakeholders' questions and needs. We started off by developing a list of questions with the goal of keeping total response time to 15 minutes or less, in hopes that that would elicit broader participation if the survey required minimal effort to complete. After receiving approval from the National Academy's Institutional Review Board, we launched the survey on April 23, 2024, by partnering with several of the major professional societies and organizations that are listed on this slide, to ensure the survey was broadly distributed to a large and diverse audience in a relatively compressed time frame. Survey questions focused on program demographics such as institutional type, size, and the numbers and types of species used, as well as the staff's experiences with developing, reviewing, implementing, and providing training for contingency plans that involve research animals. We received more than 200 responses, but limited our analysis to 195 respondents we confirmed were associated with research animal programs registered with USDA. Most of those responding indicated that their institutions were generally able to comply with the rule, but had lingering questions regarding specific responsibilities and how to interpret USDA's expectations. The data we collected was reviewed and analyzed to identify key issues and topics of greatest concern based on the feedback provided by the regulated community. Next slide. For the next few slides, Leslie, Colby, and I are going to provide a high-level overview of the workshop and some of the deliverables that were produced. Next slide. Dr. DeVincenti addressed the audience on behalf of the USDA and reviewed the background and rationale for implementing the contingency rule, as Dr. Fitzhugh, our last speaker, just explained. He clarified the agency's intent for referring to this new requirement as the contingency rule, surmising that use of this term would intentionally broaden the scope and intent and hopefully avoid any potential limitations that could be implied by the use of alternate terms such as emergency or disaster. He also explained that the rule provides a basic framework or foundation for developing an effective plan that includes 4 specific components, as we just heard, and I'll repeat them. They include incorporating strategies for emergencies that are reasonably anticipated, defining specific responsibilities and tasks that must be accomplished to prepare and respond to an event, establishing a chain of command to direct these activities, and describing actions that need to be taken during the response and recovery phases of an emergency to ensure animal welfare. The rule provides specific timeframes for training employees who are expected to respond and implement the plan as shown in the table on this slide. These include training all employees within 60 days of establishing a plan and then training new employees within 30 days of being hired. And also, plans must be reviewed at least annually and employees retrained within 30 days if substantive changes are made to the plan. Dr. Taylor Bennett analyzed the agency's recent inspection findings, noting that the primary citations related to contingency planning included failure to have a plan, followed by not having plans available for review during an inspection, not having documentation to show that staff were trained on the content of plans, and not reviewing plans after implementation. Next slide. When our committee decided to distribute a survey, we weren't aware that the Federation for American Societies for Experimental Biology, or FASEB, had already conducted a similar survey. We were very fortunate that FASEB was willing to present their survey and preliminary findings during the workshop, and to our surprise, there was a lot of overlap between the 2 surveys in terms of questions, content, and results. Although unplanned, this provided a unique and interesting opportunity to compare the results of 2 separate but very similar national surveys that were conducted independently and directed at slightly different audiences. The greatest number of responses received by both surveys originated from institutions classified as academic, which includes colleges and universities, followed by institutions described as industry, commercial entities, government, and others. However, most of the respondents to our National Academy survey identified as veterinarians, whereas a majority of those responding to the FASEB survey reported to be IACUC members. Other groups that participated included animal care staff, IACUC staff, researchers, institutional officials, organizational leadership, environmental health and safety personnel, and emergency response staff. Some similarities noted between the different respondents included most had a basic understanding and familiarity of contingency rule requirements. Many programs had an established contingency plan in place prior to the rule becoming effective, and over half expressed a need for more specific guidance to make sure their institution's actions aligned with USDA's objectives. Some of the common challenges that were raised included the significant amount of time and effort required to develop plans, difficulties being able to anticipate the full range of emergencies a facility might experience, devising plans with adequate detail, but that also allow sufficient flexibility to address unforeseen events, and general expectations for training methods and program logistics. Next slide. Our next session focused on lessons learned and was presented by individuals from a variety of different backgrounds, disciplines, institutions, and programs who have firsthand knowledge and experience managing programs during emergencies and disasters. Some of the key takeaway messages are listed on this slide and include remembering that contingency planning is a continuous process and never complete. Plans should always address events that are expected, but also equip staff with the knowledge and skills to respond to new and unanticipated events. Emphasizing maintenance and redundancy for equipment that is mission critical. Making sure plans align with organizational needs and resources, and this may require finding economical solutions for programs that are small or have limited resources. Making sure plans have adaptable components that can address a wide range of incidents. Building partnerships with stakeholders on the national, state, and local levels. Making sure contact information is accurate to avoid communication lapses among staff. Recognizing an organization's inherent vulnerabilities, particularly as they relate to information technology tools and services. Making sure to test and critically evaluate plans during drills, simulations, and actual events. And most importantly, never forgetting the emotional and physical burdens that emergencies place on responders and those who are affected. And now I'll pass it off to Leslie Colby.
Okay, next slide, please. So session 4 explored the key roles that various groups, both those internal and external to an institution, play in contingency planning, as well as some of the challenges they commonly face in doing so. So to highlight just a few of these, the institutional animal care and use committees are responsible for assessing the adequacy of animal care programs' contingency plans, which is often done in conjunction with their semi-annual programmatic review of the animal care program. It's through this assessment that the IACUC can help identify any deficiency in the plan, as well as needs for additional resources that they can then bring to the attention of the institutional official. The IACUC should also help to ensure that the animal care program's contingency plan is appropriately integrated into the institution's larger disaster or emergency response plan. IACUCs also participate in drills and exercises designed to test and evaluate a program's contingency plan and often maintain relevant documentation needed to fulfill regulatory requirements. Animal program personnel, including senior animal care technicians, facility managers, and veterinary personnel, frequently engage with multiple stakeholders when designing, testing, and implementing a contingency plan. These stakeholders may include researchers, facility engineering groups, security teams, safety professionals, internal and external compliance personnel, and first responders. These interactions can prove more complicated when the program extends across multiple buildings and performance sites. Through close collaboration with many of these same stakeholders, animal care personnel regularly evaluate facilities, equipment, and infrastructure, not only to ensure their proper function in the event of an emergency, but also to recognize recent modifications or changes that could impact the contingency plan. Animal care units also ensure that suitable supplies are available for use during an emergency, such as through strategic stockpiling or relocation of items, such as food, bedding, and water, and through creation of legal or collaborative agreements with vendors and partner institutions. They also play a key role in training a wide range of personnel in their respective roles and responsibilities during a disaster response, with special emphasis on procedures, equipment, and systems that are infrequently deployed or deployed only during emergencies. While often leading risk assessment efforts pertaining to a multitude of potential hazards, environmental health and safety professionals are key members of institutional incident command teams and serve as intermediaries or liaisons between institutional stakeholders, such as institutional leaders, facility managers, veterinarians, and researchers, and external entities like emergency responders, police, and regulatory agencies. Given their unique skill set and familiarity with a broad range of regulations, they help institutions recognize and meet regulatory requirements and are skilled in communicating risks to stakeholders and the public. Facility engineering staff, such as an institution's physical plant personnel, are instrumental in identifying and prioritizing proactive measures that can help prevent or minimize the impact of a disaster on equipment, systems, and structures. Their contributions include providing local expertise, maintaining robust preventative maintenance programs, designing layered redundancies in critical systems, and helping to identify aspects of construction and renovation projects or installation of new equipment that could influence an institution's contingency plan. And finally, community and national response networks promote use of commonly accepted terminology and standardized emergency response frameworks, such as the Incident Command System and the National Incident Management System, to facilitate communications and coordination among participants in an emergency response. They also contribute expertise during drills and exercises that institutions can then use to improve their existing contingency plans. Through their collaborative structure, community and national response networks can also assist institutions in strengthening their relationships with external partners. Next slide, please. Multiple common challenges were identified by all or most of these groups, including those listed here. Common themes included clearly identifying and ensuring personnel's understanding of their specific roles and responsibilities during a disaster response, creating and maintaining plans with the right level of detail and flexibility to remain relevant across a broad spectrum of potential incidents, keeping information critical to contingency plans accurate and up to date, creating and administering effective and engaging learning experiences, ensuring successful integration of an animal program's contingency plans with those of the institution and local, regional, and federal organizations, and continually applying the cyclical process of contingency planning. Next slide, please. The fifth session centered on training. However, it should be noted that there was much discussion on the topic of training throughout the entire workshop. During this session, several strategies were discussed to improve training outcomes. A key focus was the need to provide personnel exposure to broad emergency response concepts and offer opportunities for critical skill development, so personnel are best prepared to respond effectively in unexpected and rapidly evolving situations. Additionally, it was emphasized that while didactic or self-study trainings can be suitable for some certain content, learners are more likely to retain and apply knowledge through experiential training that is engaging and simulates real-world emergency conditions. Finally, the session highlighted the advantages of involving external organizations, such as emergency response organizations and partner institutions, in training events to further enhance the learning experience and enhance collaborations. Next slide. The final session consisted of a brief panel discussion focused on identifying key issues that institutions should consider as they continue to refine their contingency plans and prepare for the future. Key highlights included the importance of encouraging personnel to develop their own personal emergency response plans and maintain essential supplies so they can be best prepared to support the animal care program while also knowing their home and family are safe. Recognizing that the complexity of preparing and implementing a contingency plan can vary depending on the institution's type and size. Additional resources, both financial and organizational, may be available to animal care programs needing support to fully develop or implement their plan. And the value of relationships and strategic partnerships cannot be overstated in ensuring an effective emergency response. Next slide, please. Overall, we consider this workshop a great success, and as it fulfilled the statement of tasks outlined earlier in the presentation, while also providing valuable insights for animal care programs in their institutions. During today's presentation, we only scratched the surface of the many topics that were discussed. However, several resources are now available to further explore the material. These include live recordings of all sessions, the workshop proceedings in brief, which summarizes the key points from each presentation and panel discussion, and a separate white paper highlighting findings from the pre-workshop survey described by Susan. All three resources, the live recording, the proceedings in brief, and the white paper, are available on the National Academy's website. I did want to take this opportunity really quickly to do some thank yous. So I wanted to thank the USDA for sponsoring this workshop and providing an opportunity for the lab animal community to share their experiences and provide feedback regarding the contingency rule. My fellow committee members for all their hard work planning the workshop, including creating and analyzing the results of the pre-workshop survey. Each of the session presenters for sharing their expertise and perspectives. The National Academy staff for their invaluable guidance and assistance. And lastly, a big thank you to those who responded to the pre-workshop survey and those who attended the workshop or accessed the resultant videos and other resources. We hope you found the information useful and welcome and encourage your feedback. And I think it's back to Nia.
Thank you for that, Susan and Leslie. And at this time, we'll take any questions that anyone may have.
I think while folks are queuing up and getting their questions ready there. Oh, we got one here. I was about to come in with some prepared ones, but we got one here. Nadia asks, can you please share a link to the resources in the chat so we may copy it? Thank you.
Thank you for asking. Yes, we'll post that now.
Hey, Mia, I know they wanted to type them in, but this is Joe Newsom calling. I was wondering if I could get a clarification on the extent of training for new hires on the contingency plan. What is the expectation? Is it just a quick overview, or is it a detailed, documented, focused review from top to bottom?
That's a good question, Joe. Thank you. I'd actually like to ask Dr. Oh, go ahead, Susan.
I was going to say this is probably a question that Dr. Fitzhugh should respond to, but in speaking with the experts and also hearing feedback from the participants, it sounds like a training program should be designed to fit your organization, and the primary focus initially should be on those who are actually involved in the response effort. But I'm not really qualified to speak for the USDA, and I'll let Dawn correct anything I said.
Yeah, thank you, Susan, and thank you for the question. So you're absolutely right. It's really dependent. What the intent is to make personnel aware that there is a contingency plan, that emergencies could happen, and to become familiar with that within those first 30 days of their employment. Certainly, we recognize that some folks may have the role, for example, of evacuating animals, and you may need to make sure that they are through all of their other hurdles to employment and trained to move animals appropriately before they would actually be trained to a point where you would feel comfortable that they could fulfill their role in the contingency plan. So the long and short of it is it does depend. But I also too want to clarify, I'm hoping I didn't misspeak in the beginning. The training is to occur within those first 30 days of employment. We don't, however, require documentation of that. So that's not something that is asked for. And I was a little bit worried that I might have misspoke, because in my mind, as a regulator, I'm sure many of us can understand, if it's not documented, it's like, was it really done? But we do not require that in our regulations.
Thank you for those clarifications.
Mitch has our next question.
Yeah. A question here for Susan and Leslie. Can you discuss some of the limitations of the surveys that were conducted, and particularly stemming from their anonymous nature?
So I'll jump in again. I don't want to hog the microphone, but one of the limit. I'm only speaking for the National Academy survey because I wasn't involved with the FASB survey, but we realized that by having an anonymous survey that there was, and we did not limit responses in any way. So one response could be received from the same individual could respond more than once, or we could also receive multiple responses from the same institution. I don't think that that's the case, just based on the data that we received, but that was a possibility. We also had a limited ability to verify the accuracy of responses because it was anonymous. And we recognized that there could have been interpretation errors between respondents that may not have been apparent in the data that we received. Leslie, do you want to add anything?
Yeah, I'll throw in one too of some of the questions talked about how much effort or time was required to accomplish things. And, people can respond with what they knew of, but if some effort or time was required by somebody outside of their purview, they wouldn't necessarily known about that and reported it. So there could have certainly been an underreporting of time or effort for requirements of fulfilling the plan. I think that's it.
I see, yeah.
Could I jump in here? So this
Please.
is Naomi Harlem-Bacchus. I was at FASA when the survey was conducted. I'm now with Americans for Medical Progress. But I would say also, in addition to, of course, there are some limitations with any survey that has anonymous responses, but in a way for this particular topic, it was a strength because when it comes to the challenges and maybe some of the hiccups that people were feeling in terms of implementing the rule, having the freedom to speak on what those challenges were without feeling like they were going to be possibly, looked down upon based on where their affiliation is with or what their role is, that's a strength in my mind, especially when it comes to the comments. So in my mind, that I think that was a big positive with this survey, and we learned a lot in going through those responses.
Thank you for your responses, everybody. That is good. We have a question here from one of the audience members. For the drills, is there a recommended frequency to enact your training of the drills? It's good for anybody that wants to chime in.
Let USDA comment if they want to mention anything to that, but basically it's what's necessary for your institutions, what's really right sizing it. So I don't think there is a correct answer. I think there's a common frequency people will often use, and that comment can be very different. Some would say every 6 months, every year, every 3 years. But what it really kind of comes down to is what's really necessary for your institution. Different institutions are different sizes and complexity, so there's really not a one size fit all. What you're trying to accomplish, though, is for the people to be very clear on their roles and responsibilities and have reviewed the documents enough so that if something happens, it's already fresh in their mind, as opposed to trying to remember something that happened eons ago. So I'll go ahead and let USDA kind of comment, but whatever is right for your institution, which I realize is a non-answer, but it kind of goes along with it depends. My favorite response to most questions.
Yeah, no, that's a great answer, Leslie. It really is, because you're absolutely right. While an annual review is required and then training to be done on any substantive changes, which, that's open to interpretation as well. Staff needs to be trained within 30 days on those substantive changes. So the answer is it really does depend. How often do you change personnel? What size facility do you have? How comfortable are people? Perhaps you've been through many emergencies and much of your plan involves evacuations and people are comfortable doing that. So it may be that you don't have to plan that in as often, but certainly like Leslie and Susan have said, the goal is to really create a culture of readiness within the institution. And so whatever it takes so that, so that the people who are going to be caring for the animals are comfortable with their roles, then that would be the answer that's right for your institution.
And I'll just add one more thought, and that's that a lot of drills are, they involve the entire institution and they're well planned and orchestrated and have a lot of involvement. But you can also make drills relatively simple and at the laboratory level or at the room level or whatever, and also get some useful information just by doing them spontaneously. So they don't have to all be massive efforts.
All good points. Thank you for that. Another question here. During the contingency planning process, what are some of the best strategies for gathering and incorporating feedback from your institutional team and stakeholders?
So I'll start off on this one. So I'd say one of the first key things is to make sure that you have leadership and institutional support for this process, so that you have the resources and the time available to do planning. Make sure you have an inclusive environment that encourages all employees to participate. Identify where there's opportunities or mechanisms to receive and give feedback, including having anonymous options, reporting near misses, and using technology creatively to gather this information. Once you have the information, make sure you review it and analyze it so that you can give feedback on what you heard. Conducting regular assessments that we just talked about is another key aspect. Maintaining transparency so that everybody understands how the process works, how information is being collected, how it's going to be used. And maintaining effective lines of communication throughout the organization. So. Did I use up all the bandwidth on that? So,
Yeah, I think you covered it all. I have nothing else to add.
Okay, thank you. I just wanted to make sure that you had a chance to answer if you wanted to add to it, Leslie, or if anyone else wanted to add it to it. If not, then I will say this concludes our Q&A portion of the webinar. And I just want to say to everyone, thank you for attending today's dissemination event for the Contingency Planning and Training of Personnel Rule APHIS-2020-0101, 1 year of implementation, proceedings in brief release webinar. We are at the close of our release event, and I want to express my appreciation for your attendance and your participation. If you're interested in viewing the recording for this event, it will be available through the National Academy's workshop webpage. And as Leslie mentioned previously, the workshop proceedings in brief and the supplemental resource document are both available for download on the workshop webpage. Thanks again, everyone, and enjoy the rest of your day.